You ready for me?
Is that right?
Yeah, I brought you guys some snacks.
Wow.
Maybe a little early for them, or you want them, or?
Nice.
We only want a premium reduction.
They're from all of us.
Well, actually, had a pretty good year.
Does everybody see how this works here?
Yeah,
Well,
yeah.
those are from all of us.
Those are from Nothing But Cakes.
Yeah, I saw the box and knew.
Last time we got those, we got bashed.
Oh, sorry. I'll
We'll
take
see
them.
how it goes.
Yeah.
Thank you. Did anyone else?
Have you had cake from them? So much on the rest
All right, well, looks like you got quite a bit of snow last couple weeks down here. More than we got up our way. Just donated for official Derek Dick with Katie Companies.
No.
Okay. Joe's normally here, and Joe's the self-funded guru who knows his reports, but he couldn't be here today. He has something with his family come up that he couldn't be here. So we'll go through this and just kind of we like coming a couple times a year and reviewing things and seeing where we're at on the year and how claims are running and things like that. So kind of go through here. If at any point you have any questions, please ask. But on page 2 there at the bottom, this is kind of our year-to-date claim performance, and going back to renewal, we had a 0% renewal across the board last year, and the fixed costs were flat, which is good. We always want to try to keep those fixed costs and the overall cost low. Like I said, last year was 0%. From 2024 through last year, it ended about the same as we had been running. There's a difference of 10K, so like I say, pretty well flat. Right now, the estimate for 25, 26 is premature. We're just doing about a third of the way, a little over a third of the way through the plan, but our estimate, we're on track to spend about 1.7 million in total spend on the year through RX and medical claims on the year. You can see on page 2 there, if you go down to the bottom, that middle column, paid medical, it just kind of breaks it out through year, so from 2021 through current. Like I say, current year, we're just a few months in. Page 3 at the bottom, this is the breakdown of current year compared to previous year. So the little box at the bottom, that's all of last year. The box at the top that's a little bit bigger, that's through our 4 months this year of claim data. And you can see right now we have about $475,000 in paid claims, which over the previous year at this point is down 11%, which is always good. Joe made notes here, so the enrollment is up 2% overall. The medical claims are down 8%. The RX is down 16%. So like I mentioned, we're overall down 11%. We ended 24-25 receiving 12,000 in spec reimbursements, and at 82% of the attachment point, which is in self-funded. That's a really good plan year, and so far we're off to a good start and projecting better than that at this point. Any question on that so far?
Is that RX down, you think, because it went to some generics?
Probably. I know we tried to do some things in the plan to go that way, and I do think, I don't know if you follow legislation, I do think that is a big point this year, that they're trying to have some cost containment on prescriptions. We have, seems webinars on once every other week at our company, just because it is such a high cost, and I think they are doing some things legislation-wise to reduce cost. I know there are a lot of companies that come up with outsourcing from Canada, because they really are about a third of the cost. So I know a lot of people within the plan, and we'll definitely have those options to outsource, because it is a huge savings. So there are some things being done on the RX side of things that I think will be beneficial cost-wise coming up throughout this year. The next page, page 4 at the bottom, this is just from when we started, kind of shows the high cost claimants. There were 17 at that point. Of those 70 claimants, over 50% of them were in 24-25. Since then, 6 have exceeded the spec deductible. That means it goes to the reinsurance carrier to pay at that point, and 5 also have turned off of the plan. So we're looking better on large cost claimants. You can see for 25-26, we do have 2 currently that have already reached that spec deductible, so we'll get reimbursements on those for the remaining of the year. Next page kind of talks about the drivers, and you can see it's listed out. Outpatient services, is the main cost, about 243,000, that's pretty common. Your guys' emergency room spend is, pretty high. You have 166,000 in emergency room spend. You know, the emergency room is a great resource. We always try to encourage people, if they can wait the next day and go to a regular doctor, it's way cheaper on them and the plan.
Does that include like, I'm sorry.
No, you're good.
Like, not emergency, but what's like urgent
Urgent
care?
care, no,
Is that
no.
emergency?
No, it's
Okay.
just emergency
Okay,
room
I
only.
was
Yep.
just curious.
Yep, no, good question. We like urgent care.
Okay.
It's cheaper
Okay.
to them and to the plan.
Okay.
The data shows that, only about 13% of those ER claims were unavoidable. So, I mean, there's not many people that aren't going, you know, for a fever at night or something like that. They're unavoidable, to go in those cases. So, claim trend, on that is 1% increase, so basically flat. And then the outpatients, like I said, most paid, low patient utilization, which is good. Just once again, reiterating your plan year's running fairly good at this point. Page 7, at the bottom there, reviewing how many are getting the routine exams and immunizations versus the benchmark. So this is over routine offices over the last 6 months. So 123 have met to get the routine visit, 61 have not met, so 66% are getting their routine preventative covered at 100%, which is over the benchmark, which is good. You know, benchmark is what is overall the book of business, gets those procedures done, and you guys are over that. And over the last 24 months, 87.5 of your employees have met to get their yearly physical or their preventative lab work and things like that. So that is good, because anytime we can get that done, we can kind of outline stuff early on and kind of get ahead of it before it becomes a major cost. One thing though that is low, your flu vaccine is very low for your employees. I don't know if you guys do it.
Peyton, have you run any of those through?
We do, we ran all of them through, we had several this year actually, so we ran them through the health fund.
Okay.
So they went through there, so they don't normally come through claims through,
Oh, okay.
through
That makes
Mary
sense.
Jane.
They did a lot.
So we pay it out of the health fund, but we did do more this year than we've, done in
Oh, well, that's
a
good
while.
then. That's good then.
Yeah.
It's just, like I said, Joe made notes here, and, but if they're doing it that way, they wouldn't show up on claims, so you can ignore that then. That is good that they're getting their, preventative stuff covered. And that's good service you guys provide, because they don't pay any of that then, do they?
Who?
The employees themselves, it just
No,
all
they
comes to the
don't.
fund? Okay,
Yep.
Yeah.
And we go on site to find them, to get them vaccinated.
that's good. Very good. Page 8 then, this is just our discount. You know, we always like our discount to be around 60-ish%. You can see last year we averaged 61%. And the first column there, prior year at the very end, 61%. This year, our current discount's running about 58%. So that's something on our end that we'll investigate to why the discount's down 3%. You know, we'd like to see it go though where the discount's getting better. But generally, in rural areas like this, 60% is generally what's called. So pretty good discount all in all. Page 9 there at the bottom, more benchmarking. You can see the ER utilization versus benchmark. And this is listed as visit per 100, or 1,000 to normalize. And so you actually have 147.7 of high severity ER visits. And once again, we spoke on this earlier, but only about 13% of those are avoidable. So you don't have a large percent that's going to the ER unnecessarily, but there are some. Next page 10 kind of breaks that down. And then page 11 gets into the prescriptions. You can see diabetic is the leader, as it was the past couple of years as well. But there is a significant increase from 24-25 through this point, which isn't uncommon. I would say in my book of business, probably 90% of the top RX is diabetic. So that's very common. That is one thing that I do think Washington legislation is looking at, is those diabetic prescriptions. So I think we will see some movement, there. What though, we're just gotta wait and see how it settles out. Blood thinners was a big, so your two biggest jumps last year were blood thinners. They went from 12th on the list to 5th on the list. And then arthritis went from 29th on your list to 14th on your list. So, I've had a couple cases pick up there. But the top prescription, the 3rd, the 4th, the 5th, and the 6th are all diabetic prescriptions. Which, like I say, that's very common. And those are the ones that are kind of under a microscope being looked at for, discounted, prescriptions going forward, I think. Won't do that fast, but just kind of like to give you how we're running so far right now compared to last year. Like I say, we're about 11% better at this point, which is good. You know, we always try to monitor that. If you have something, you know, that looks out of the ordinary, we try to point it out, or we'll go to Mary-Kay, the PBM, and try to discuss, you know, are there cost-saving measurements within the plan that we can do, and so Joe and I have done that. I think right now, to start the year, everything is running fairly smooth and good, unless you guys see something on your end.
It's early.
It is early, it is early, but things are going good. We don't ever really get any calls on out of network, and usually in our business, that's the main call we get if someone's out of network. I think the network's good and working, so, yeah, hopefully you guys keep having a good year, you're healthy, and if you need anything from us, don't ever hesitate to reach out. We're always happy to help and do what we can.
Appreciate it.
Yeah.
Thank you.
Any questions?
Always make it
What's your
easy.
name?
Derek.
Thank you.
Yep. And we'll probably get on the agenda and come back down in 2 to 3 months, after we have 6 months of data, because then we kind of get a good idea of what a renewal is looking like at that point. Unless something major gets up, so.
Sounds good, thank you.
All right, yeah, thank you guys, appreciate it.
Where you go from here, Gary?
Going over to the ambulance.
Oh,
Terry?
not far.
Nope, not far, and then
Okay.
we actually, have quite a bit of business down here, so I always try to stop in and do reviews with them, so, stop with them, and, yeah. Yeah, thank you guys.
Thank you.
Stay warm. All I can do is just kind of warm up. All right, thank you.
Thank you.
Yeah,
Toby, all your people's here, aren't they?
Yes, sir.
Let's go ahead and get you guys out here.
where?
Thank you.
I'm Toby Bankley, the superintendent down in Galena, USD 499, right in the southeast corner. And I brought our board clerk, our board president with us, Denise Titus, and Carrie Spoon. She's from Chanute. You guys may know those folks. She's with the Southeast Kansas Regional Planning Commission. I have a folder for you. I'll kind of talk through those if I can give you one of each of those. In Galena, we recently passed a $7.5 million bond, and we're in the middle of construction now. First phase 1 is almost finished, and phase 2 will be the Liberty Building, some renovation going on there, and then phase 3 will be a new preschool building. Right now, we have 2 temporary classrooms out there that have been there probably 40 years, modular buildings. We'll get rid of those, build a new preschool center there. It'll house our 4 preschools. We have 2 in the morning, 2 in the afternoon. Well, on that property, on the footprint of that property, there's capacity for expansion, about a 4,000 square foot footprint on the back side of this new preschool building that we're going to build. Well, the board and I have been talking for a while about ideas for that, and I went and visited a couple child care centers, and my sister of all people, Wendy Martin, some of you know her, she's the last daycare right now currently in Galena, and she's come to the end of her time. She's been out there probably, I don't know, 30 years or more. So I visited a child care center over in Riverton, Spring River Mental Health, and they have a great facility over there. They service a lot of kids and families. They've got a waiting list right now, and they won't even take people on the waiting list because there's so many folks on there. They told me basically a woman gets pregnant and goes over there and gets on the waiting list to get ready for her child to be born.
1 year waiting list. It's a year to get on, a year waiting list. My daughter called them, said if she would get pregnant, if Wendy couldn't take them, they said their waiting list is a year to get a child on.
Wow.
Our daycare.
Yeah.
Before you conceive, these are registered.
Before you
Yeah.
get engaged maybe, start getting on the, I don't know.
Yeah.
Anyway, there's a big need in our area, we're currently working with Greenbush on a capacity survey. We've surveyed about 85 people that responded to our survey about their intentions or their views on child care in Cherokee County. So we're looking for funding sources. We don't have grant capacity for this. We don't have bond capacity for this. Our bond is allocated for what we've already allocated for. This is an additional project separate from our bond. So I started exploring some different grant opportunities, and the Kansas Department of Commerce have several grant opportunities. And in your packet, by the way, that's just a picture of what our preschool will look like when it's finished. The second page there on the right-hand side, I think it might be the back of the preschool building. I can give you one, but you can look on mine. That's the footprint on the right-hand side, the new early childhood building, 5,400 square feet approximately for our new preschool. And then the back side of that is room for expansion, and it's just under 4,000 square foot footprint where we could potentially build a child care center. Okay, so I come to this meeting seeking to expand our partnership with Cherokee County. They tell me for this federal grant, our school district can't apply on its own. We have to either go through our city, and they get 1 grant a year, or the county, who gets more than one. I think it's 2 or 3 grants you all could get. And when I explored it, you guys aren't using one of the,
CDBG.
yeah, you're currently not applying for one of those grants. So I'm seeking a partnership with the county where it would be, you guys apply for the grant and partner with us, and the proceeds come to our school district to help build this project. Now this project, the grant capacity is $1.5 million is the max, with 20% matching funds. Those funds would come from the school district's budget, capital outlay, contingency reserve, or other resources that we have, the 20% match. There wouldn't be a money side of it really to the county, but there'd be some work involved. And on the right-hand side of this, of the packet that I gave you, is a contract that Carrie's folks in Chanute have drawn up with another group of people. So it's not a contract for you guys, it's just an example of what some of the obligations are and some of the work that will be required by the workers of the county. This, in this folder, there's some things, some background from the Southeast Kansas Regional Planning Commission. Some details about the workers that are there, some of their background. On the right-hand side of this, and I'll pull it out for you, at the bottom is what we're really asking the commissioners. We're asking the commissioners to take some action, enter into this agreement with us, this partnership. The back side of this is a resolution that you could look at to see if you want to partner with Galena. Now, I will say we've also reached out to the folks at the Kansas Children's Cabinet and Trust Fund, and we've applied for an early childhood block grant. This grant will help us pay for the needs assessment that we're currently doing. It'll help pay for furniture in the new facility. So that grant's already in the process through Monica Moran, some Greenbush folks, and some folks at the Children's Kansas Cabinet and Trust Fund people. Let's see what else. When I was exploring this grant, there's some requirements to the building. I wanted to make it under one roof and just extend our current child care center, our current preschool, and make it the whole building. Well, the federal grant, there's requirements on that, it can't happen. So we have to build our preschool first, and then on the back side of that is where we'll have a freestanding building, which would be the child care center. We estimate capacity to be about 70 kids that it would service, infants through preschool age kids. Right now, our preschool are half-day programs. And I believe we lose some folks in early childhood. They don't send them to our preschools because they simply can't take off work in the middle of the day and go to morning preschool and then transport their child, because we won't transport them, to a daycare somewhere. So I believe we lose some kids starting school at 3 and 4 years old because they can't do the transportation. If we had our own child care center, the second half of the day, we'd go straight into our daycare or child care center in there, if we had that on our campus. As well as infants, 1-year-old, 2-year-olds, we would grab those kids even sooner than we get them now and put Bulldog shirts on them, and they'd be Bulldogs for life potentially, which would increase our enrollment in Galena. You know, the population of Cherokee County, and maybe all of Kansas is going down. You may have heard some of that. Enrollments aren't as high as they used to be. We're tucked right into the corner there on the state line, and you guys know that well, being from this area. We draw many folks from Missouri. We have over 100 kids that come to our district from Missouri. Potentially, there's the potential there to draw kids from Missouri over here as families are looking for childcare and quality preschools in our area. And we get those folks over here, they spend money in our county, and they Galena Bulldogs, and they come to Cherokee County and be part of Kansas, part of our program. We think it's a good idea. We can't do this without you. Galena, you know, is, if not the poorest, one of the poorest districts in Kansas. We set the bond cap at the highest, 51% right now, based on our assessed valuation. So the only way to do this is currently is with this large grant, large federal grant. And because of the requirements of it, we can't do it on our own. So we need to partner with you guys if you're willing to do that. Carrie can answer a lot of specific questions if you have things about the partnership and the grant and the requirements of that. I can answer whatever maybe I can answer. Any questions you might have.
I'll say Toby called me and invited me to a Zoom meeting with the mayor and himself and Carrie when they brought me in the loop about this. And I know we need that daycare for countywide, and we know our population is dwindling. We know that Missouri people might come here and build up that population, build up our tax base if we do things. Daycare, and the bigger thing is the housing, but we're really addressing the housing in the last few years. With NRP. But my first thing was telling Toby, good idea, but we just don't have the administrative staff to administer something like that. But I'm glad everybody's here and making this presentation, and let's at least see if there's a way that it might work out. I'm glad you brought that contract, Carrie. I had asked Carrie for one that I could give to our legal counsel, just want to see how this meeting went. But, you know, like he said, my first thought was Economic Development Committee, and Carrie said, no, it has to be a government entity. But the thing with the city not being able to do it, even if they could do it, they would be leaving $750,000 on the table, because by the county doing it, they can go for that $1.5 million as opposed to $650,000, right?
Correct.
Yeah, it was all population, that's right.
Right. And another question I had, well, we can't do that, we don't have an LMI, we're not gonna get an LMI. And Carrie said that we don't have to have an LMI. I don't know the technical, but anyway, we don't need to know the technical.
Child care centers are exempt from that.
Because, whatever, we don't have to have an LMI. So, to me, the only, and it's not a minimal obstacle, but the only obstacle is that administrative part of it.
Is
And
that
I
like
just
the
hate to see
paperwork
us not to be able to
So, yeah,
make this happen because of
What,
administration.
can you
May I?
tell us what it would
Yeah.
entail?
In the past, and the way I would propose we do this is the Southeast Kansas Regional Planning Commission would handle the administrative side. I would keep this project on my desk, but there would be documents that would need to be signed by the chair of the commission. There would be communication that would need to flow through the county clerk's office, whether it's the county clerk or someone else. But as far as what needs to be done and when, that is something that I would provide the guidance, and it's really just a matter of having paperwork signed. Once the project is under construction, pay apps would be processed through the county. The county would be the one requesting the grant funds from the state and then issuing checks. there would need to be an MOU or some type of agreement between the school district and the county as far as how the share funds would flow. Is it gonna be by pay app and the school district sends the county the check, or do you hold it in escrow? Those are details that would need to be worked out prior to submitting the
Are
application.
those, and what does MOU stand for?
Memorandum of Understanding.
Okay, is that something that your office has dealt with similarly to the contract that you just?
I am not an attorney. I have things in files that I could offer
Right, not
as
create,
examples,
but
but
yes.
I would definitely let the county attorney speak to exactly what you want in there. But
The specifics about who pays for what and who's required to do this or that. We do that all the time with other groups we partner with around, with our school district. So, and you may have seen some of those things before. Through this partnership, the district's willing to do whatever we can as far as the lion's share of the work, to not burden the county workers on whatever it would have to be.
I think we'd have to give this to our council and let him look at it, but
Yeah,
My
it'll
goodness, if
take a
there's
bit of
any
time
way-
to cut through all this.
any way to make this work, it would be a blessing to not just Galena, but countywide, because Spring River Mental Health, I mean, they don't just take care of the Riverton area. Same way with
Oh,
you,
sure.
I mean, it's gonna affect the entire county.
Yeah.
It's gonna take burden off of maybe other care facility, or what, I wanna say, daycares.
Yeah.
If they exist, I mean,
What's the timeline on the grant?
So the early application's open now, so it's already started.
applications will start being taken March 14th, and CDBG the last couple of years have changed how they do this. It used to be all the applications went in on October, and they're taking them monthly now, so starting mid-March, mid-April, and we just keep submitting whatever we have ready at that point throughout the year. I think it's September, October this year when will be the final date, but as soon as we have the go-ahead, I can work with Toby on, preliminary engineering report or architect report that's part of the application. Probably from the time we would get the go-ahead, 3-4 months to have an application ready to submit.
And the go-ahead would be the MOU with the county and the resolution you guys would make to have a partnership with our school district, right?
Yes.
I'm speaking on behalf of Carrie, she does a wonderful job.
yes.
What she does, I'll say
Yes,
that.
she
The
does.
meetings I attend up there, I think she's top notch.
Thank you.
That's why she's executive director.
That's exactly right.
Can you think of things you want
I
to
just
keep
feel
from us?
fortunate to have
I
you
mean,
here
what
today, cause I
templates-
think about how many counties
You know
is
what
this,
that
and you have
MOU
so
would look
many
like.
members.
You've already got a
12
sample
counties, yes,
contract.
and 80-some communities.
Yeah.
What that application would look like in some, the entire completed application, things like that.
The grant application.
Yeah,
We have some from a couple years ago.
Yeah.
The application's been tweaked a little bit, but I can certainly send you one of those.
Yeah.
If you'd like to see that.
and then you've partnered with Chanute, is that Neosho or Montgomery County?
Neosho.
Neosho County, okay,
We've done, we have a nonprofit childcare in Pittsburgh that's about ready to close out, and one in Humboldt
okay,
that were awarded 2 years ago.
okay. And those have the MOUs and the contractual requirements?
MOUs is something new required by
Okay.
Commerce this year.
Okay,
Peyton has a question.
I'll help if there's something that I can do to
Oh.
help with them, because we have MOUs with everything, and,
Well, don't do this, do
We've-
this.
we've-
We wanna see you.
I mean, I know a little bit about the CDBG grants, and so, I mean, anything that you need help with, I would
Yeah.
help that administrative part, if that's something that you guys wanted to do, I don't mind.
I appreciate that, thank you.
Yeah.
Our children appreciate that.
I'd say where we're at now is letting counselor, this is all new to him this morning. Let him look at this and,
Do you have a card that Carrie could have, maybe to email things to you?
I think your information's in the packet.
Yes.
I'll reach out to you with sort of a laundry list, and then we'll start getting into it.
Okay, that sounds good. Thank you.
thank you for being here.
Well, thank you all. I mean,
pleasure.
I think it's a needed deal for sure.
And if you needed me to come back at another meeting, then you just holler at me. I'll probably reach
You know
out,
where you're at.
I'll probably reach out to you and see if there's anything you need between now and the next meeting.
Okay,
Is that all right?
that's fine.
Anything else for me? Appreciate your time.
Just tell Wendy and Doug that she's not ready to retire yet.
I know. Thank you for your time.
Thank you, thanks for coming.
Thank you.
Can I have that,
Thank you.
Toby? Your presentation?
Got some scribbles on there.
That's okay.
So don't worry
I know
about
how to
that.
scribble
Do you
too.
want Carrie's thing?
Sure. Thank you.
I have nothing but. Hello, how's it going?
Good, how are you?
Good. Hello, how's it going? Good to see you.
Good to see you.
Sure, give me a hug.
Jason, did you see my teams? I got them charged.
Spring River.
Hello. How are you?
Very good, how are you?
Just a day.
It's the day already.
I thought we were gonna be late because we took somebody ahead of you,
That's
just
okay.
because they were already here.
That is okay.
So we weren't too late.
Go ahead and sit down. And you can even bring a chair up. I'll just grab a chair. Stacy and Stacy.
We're ready when you are.
Okay, great. Well, we are just here for our annual, signing of the agreement if, we were ready for the budget. And it looked like from what we could find online that we were, so we tried to fill in the numbers that you identified. I wanna make sure that you had the same information that we did. We have two signatures, one for each of us.
This is, I remember, but these, I mean, we just would have to, correct?
This is
I'm sure you
what
have
we
it
printed
right.
off.
Oh, okay, good.
Right there.
Well, those, you've matched it with this, we're good.
Okay.
Thank you so much.
That's just super tough.
Yes.
Just a formality. of what
So
we
this
wanna
was
do.
actually the notice of the hearing of what you proposed,
Mhm.
and it, as long as it looked to me like it was approved, but.
It was.
Okay.
Yeah.
How have you been?
Very well. I have a question for you, and I wish the order had been reversed. On our agenda today, we have about that holiday pay.
Yes.
Were you affected, was your organization affected by the presidential mandate, December 18th, of saying that?
Yeah, no, we are not a federal entity, we're a 501(c)(3) non-for-profit.
Don't you take federal funds?
We do receive federal funding.
Quite a bit.
So, we didn't interpret that applied to us, but it may, and we may need to look into
Oh,
that.
you don't wanna look into that.
Okay. We receive federal, state, county
Right.
funding.
No.
So the president, mandated a federal holiday for federal employees. And I suspect that we don't have the same holidays as the federal government already.
Right.
We have quite a few less, actually, we have, 9 holidays that we have, so we have never,
So when you would fall under that guideline,
so we don't even fall under the state guidelines. They have several more, not quite as many as the federal government, but we've never, and to my knowledge, the other community hall centers across the state that are not affiliated with their county, that are, nonprofits like we are, have their own set of holidays, and most of them don't have the same number as the state and the federal. There's just quite a few holidays.
Let's see.
One of those is yours also.
Oh, great. I would make a motion that we approve the Cherokee County Mental Health Funding Agreement for the year 2026 as presented.
second.
Motion second to approve the 2026 annual funding agreement with Spring River Mental Health. All those in favor?
Aye.
Motion carried.
You've been doing well.
Thank you very much, as always, we appreciate your support.
Yeah, thank you for coming.
Everything going good?
It's been very busy, so we'll have a lot of, information to present when we come in June, in terms of our 2025 year. We expanded our services, as you know, the last couple of years, and we have really continued to see that growth
Good.
and our expansion of services, so very pleased with that.
How many are in your daycare, your capacity?
So we don't have the daycare, that's Big Top Education Center, but they, I believe that, she has about 50 is the last time, Samantha Phillips is the director there. And I know she has been looking at trying to, increase her capacity and has been looking at building, I think she's been working on funding.
We were talking about that right before you came in.
Yes, so she would, I'm sure be happy to come and present it.
Oh, it was just a curious question because Galena's attempting to put one in as well with the school, so.
There is a tremendous need, statewide, as you know, for childcare, so that has, been something that I believe, pretty much every county in Kansas is experiencing. And I noticed that Neosho County was also, looking at one of their USD board 13 is looking to try and do something with childcare as well.
Well, appreciate you.
Perfect.
Yes.
Thank you.
Thank you.
Careful with the walking, the streets are
All
clear,
right.
it's not walking.
They were actually really clear. Somebody did a great job.
Thank you.
Thank you.
You have your new hire.
Mhm.
The maintenance.
Yep.
Right on the- Okay. I'd make a motion to hire Sharon Hanford. At the rate of $15.50 an hour for courthouse maintenance.
Second.
Motion is second, all those in favor?
Aye.
Aye.
Motion carried.
You want the settle thing?
Appreciate that. Also, can you check, see what our bill was for K-Camp last year?
Let
I can't.
me see if I have.
It said on that cover sheet that they told us, and I think we prepared for 12.5% increase average. I think we might have looked 15% increase or no, but they said at actuality, all the members, it went from -3 to 20 some percent. So hopefully, we're at least
Hopefully we fell into our.
within,
She's
yes.
gonna bring it. Oh, look, she's gonna find it. You want this next?
Sure. This is for the Elvis program, which is for the election stuff. Taylor needs the board to approve a special check for the amount of $6,300 for the 2025 Elvis invoice.
Remove that we authorize that check.
Second.
Motion second to authorize a special check for Elvis in the amount of $6,300. All those in favor?
Aye.
Motion carried.
Thank you.
Yep.
Oh, that one. No, that is. Okay.
Did you fix it?
It fixed itself,
The temperature change?
evidently.
Just needed one of those.
We call that Formica.
Mhm.
All the Formica that filled up on the desks is.
It was flapping.
No,
Now it's tight as it ever was.
Great. Morning, Belinda.
Good morning.
We're ready for you.
No, you are.
Oh, yeah. Move right along.
I say you run a little early then, huh?
Oh, yeah. Okay, shape file.
Okay, what do you wanna know? Well, so the shape file, when somebody asks for that, they first of all have
In
to,
regards to this,
yeah, City of Columbus, I think. They first of all have to fill out the, Open Records Act, which we make them fill that out.
Open what? Records?
Uh-huh, so basically saying, you know, we're giving this to you, but don't use it for
right,
third party and all that kind of stuff. And then it is a 20 cents per parcel charge because the file they're getting is a big file, has a lot of information on it. You know, has names, addresses, their mailing addresses, their size addresses, everything about their property basically, they're getting. So we've always charged for that. So, and the City of Columbus was wanting it, and the total charge is gonna be, $440 for just the City of Columbus. And they didn't get the whole, you know, county.
Prior to them, who would have purchased it before then?
We have a lot of, actually CoreLogic, I don't know if you've heard of them.
Yes, but I mean, as far as municipalities.
Yes, other cities, as a matter of fact, Baxter has requested one as well, just recently too. I'm not sure if they're gonna go ahead with it or not, but they did request the same thing. But I haven't heard back from them yet.
So
I think they were wanting like full county though, so.
what is involved from your department as far as labor and?
We have to get with, Sam's, who's our mapping, you know, person that we use, the mapping software, and we get with them and we get with Penny or whoever it is that's working on it, sometimes it's somebody else, but we tell them what all we need. Then they send it to us and then we make sure it's all okay and then we have to send it to the people. So it takes, I mean, it's really not that time consuming, but it kinda is just because of how much data is there. We're just concerned with the whole, you know, cause it's a lot. It's a lot when you're getting that whole shape file.
So your concern is,
Well, the thing is I mean, it's up to you on whether you wanna charge cities or not, I mean, it's up to you, but everybody else we charge for. If the cities were, I'm just gonna be honest, if the cities were better at getting me like my permits and things like that, it might be a little better, but we don't get permits from City of Columbus, we don't get demos from City of Columbus, and we ask all the time. We don't get permits from any of the cities, so that, you know, is another thing, if they were trying to help us a little bit, we might be a little bit more willing to work with them.
I'm gonna ask a crazy question. You know, for instance, Columbus wants this, the code enforcement specialist, Gary Holt wants, he requested for all of Columbus, correct?
Yeah, he just wanted Columbus.
How often do they come in, how often does he have to come in to get something without having this just for a certain partial? What, have you come in, instead of just having all of them, all at one, you know, all of Columbus? He's probably just wanting one partial when he comes in to look at something anyway, isn't he?
Yeah, well, he could get on our public site, you know, the integrity maps, he could get on there and he can look for anything he wants to look for on there.
Well, why don't they do that?
You tell me. We've got it out there, they know it's there.
Well, I wouldn't.
this
I wouldn't.
gives how much more information? You said all about the property description?
Yeah, and then if they
talk
want
about
extra
condition
layers,
and that kind of thing?
yeah, if they want extra layers on it, like when I'm talking layers, I'm talking like the fire districts or school districts and all that, we put a little, cause that's more layers to put in there. The basic layer is just the parcel layer, which is all the information about the parcel itself. That's the basic layer. And then if they add stuff on it, it's a little bit more. But yeah, we do have the integrity maps are out there. I'm pretty sure most of them already know about it, cause we've sent out, you know, we've told them that they're out there. So, but see, they have their own software, so what I think they're doing is they're taking our layer and they're putting it in their software, is what they're doing. That's what I think.
So then they shouldn't have to bother us again, right?
No, not after they got that layer, no. Now, if they wanted to keep it up to date, they would have to get one every year, because parcel ownerships and stuff change all the time. So if they wanted to keep it up to date, then they'd have to keep getting it, yearly or something like that.
I don't want it to be a continued problem. I don't know that it's a problem, but I think anytime we can help the cities, because the cities are paying your department.
Yeah, and
wages
if they just wanted this one-time thing, and if they would be more willing to work with us too. Now, I will say City of Galena is really good about sending me permits and demos and stuff, but Columbus, Baxter, all that, I have a hard time getting it from them.
Well, Columbus doesn't do permits.
You don't do any kind of permits or demos?
They demo stuff, but there's no permit process in Columbus
They
at all.
don't have zoning.
We don't have any zoning or
Okay.
anything, so.
Okay, well then I
That
can
would-
always add it, I didn't know that.
I could go everywhere in my house.
And they don't care.
If it becomes an issue where it is requested a lot, I can address it another time. My preference would be to not charge on this.
A one-time, so we've done this before when I was in the previous county, because we did have one city that requested it one time, we waived it, but then a year or two later, they requested again and requested again. Well, finally, we told them, we said, no, we'll give you the one time. If you request later, you're gonna start being charged.
Yeah, I don't know that we wanna establish a policy, we just say, have it, and if it becomes a problem, we'll establish a policy.
So address it if they ask again later, then I'll come to you and say, hey, they're asking again. Okay.
At least this will give them a basis to work off of, maybe.
But they can get on the integrity maps like everybody else and look at them too, so we'll make sure they know that as well.
Okay.
Good.
Okay,
Thank you.
thank you.
Let's see. Next thing is federal holiday pay.
So on that, I would ask to go into an attorney-client executive session about 20 minutes.
Found out all kinds of
Got a
information.
lot of report.
20 minutes.
Attorney-client.
This is back in year 1025, attorney-client executive session, 3 commissioners, county council, attorney.
So moved.
Motion second, all those in favor?